Hi, welcome to the podcast, Race Disparities in Maternal Healthcare. My name is Sophia, and I'll be discussing the sociological concepts and the scientific knowledge.
My name is Katie, and I will be telling you guys about a real life story about a woman in Alabama.
And then later, we're going to have an interview with Dr. Dawn Robinson, hosted by me, Megan, and Sally.
And my name is Annie. I will be introducing our topic. Today, we are going to discuss the racial disparities in maternal mortality in the United States, specifically on how they impact Black women. The data is really alarming. In the United States, Black women are more than 3 times as likely to die from pregnancy-related causes as white women. This is not just a small gap, it's a national crisis. And what's even more disturbing is that this disparity doesn't disappear when you control for income, education, or access to insurance. In fact, a Black woman with an advanced degree is still more likely to die from childbirth complications than a white woman with only a high school education. This is a systematic issue, not about individual choices. There are numerous factors like implicit bias and structural racism, which we will further expand on later in this podcast. For example, studies showed that Black women's pain are often dismissed or minimalized by doctors, which leads to dangerous delays in treatment. These disparities are not just tragic, they are also preventable.
And I'm going to bring you through the story of Angelica Lyons. It's easier to relate and understand these things when you're hearing about a real life experience. She lives in Birmingham, Alabama. She works at the University of Alabama. And for her first pregnancy, what was supposed to be a wonderful experience turned terrifying. She was experiencing debilitating stomach pain and was repeatedly sent home from the hospital. She was constantly told that it was just Braxton Hicks or just normal complications until she was vomiting bile and her baby's heart rate started to plummet. She was rushed to an emergency C-section months before her due date, and she nearly died from an untreated case of sepsis. And not only that, the university she works at was affiliated with the hospital, and she was still treated in that manner. Along with that, Black babies are so much more likely to be born prematurely at a rate of 14.8% compared to a 9.5% of white babies.
We can do this all with a framing of sociological concepts. There's implicit versus explicit bias. Explicit bias refers to biased attitudes that we're aware of. Not all doctors are racist, but some are, and that can lead to higher maternal death rates. However, we all also have implicit bias, which operates outside of our awareness and control. Everyone has implicit bias, and sometimes it just shows up in worse ways, like through doctors treating Black people differently than white people.
A direct result of this implicit bias is something researchers call weathering. It's the idea that chronic stress from experiencing racism and discrimination over time literally wears down the body. It can affect blood pressure, immune response, and even heart health. So even before pregnancy, many Black women are at a higher risk for complications due to stress-related health issues that have built up over time. When you combine this with the inadequate care during and after pregnancy, the outcomes can be tragic.
Another sociological concept is institutional racism. This is described as a form of racism which are structured politically and through social institutions. This goes back to slavery, and this continues today with racism seen in all forms of institutions.
Originating from the end of slavery, when Black midwives were often targeted and pushed out of pregnancy-related scenarios by white men who thought that they knew a woman's body better, they proceeded to create this systematically racist system.
In 2019, there was an estimated 20.1 maternal deaths per 100,000 births. But in 2020, this rise to 23.8 deaths. This is about 861 maternal deaths total. However, for Black women, the rate is about 55.3 deaths per 100,000 births, which is about 1,800 maternal deaths, which is much higher than the original 861 deaths for other races.
And then we're going to move on to this interview with Dr. Dawn Robinson.
Right now, I'm out in suburbia, Boulder County. So very few of my patients look like me. That's changing because I'm doing TV and radio and speaking in the community. So I am getting Black patients. But I've had a few instances where I watched the nurses take care of two patients for a few days and watch their interactions and how they spoke when the nurse button got pushed. And when the white woman with severe headaches needed narcotics for her headache that nobody could understand, oh, that precious thing, I just feel so bad for her. When the Black 23-year-old sickle cell patient called, she's probably an addict. And I watched it for a few days. And then at the end of the shift, I called him aside and I said, do you guys realize what you've been doing? This white woman's had a headache for 3 weeks. This Black woman was born with this genetic condition and has suffered, but you were calling her an addict and judging her, I presume, based on your skin. And there weren't any more problems. They did a study during COVID where 40 to 50% of Black and brown women felt they weren't heard during their pregnancies. And that's, you talk about millions of babies being had. And we know our Latina mamas, they have lots of babies. And for 40 to 50% of women of color to say that, that's very significant. They did a study in Florida that showed Black babies had a 50% higher chance of death if they had a white pediatrician. They also did studies right before COVID asking med students if they thought Black people had thicker skin, that's why they needed less pain medicine. And the med students said yes. It's ridiculous because we're all human. So
I just hope we can learn from history rather than repeating it and just understand that we're all people equal.
right, humanity and decency and love.
Yes.
But yes, hopefully your generation will, and the generation above you will salvage this disaster that's happening, because they're trying to erase our history. So it's going to be a long fight.
Would you say that racism in the field has increased or stayed the same?
I think it's increasing. I think there's still good people out there, but the people who don't want to lose power and the people who are afraid to not being at the top anymore are pushing the issues. And the people that have been sitting there, maybe being quiet, are being encouraged. So, yeah, I think it's worse in 2025 for sure.
Do you think there are any key or systematic procedures that perpetuate racism?
The senior vice president for community health equity at Rush University Medical Center. And they're looking at a bill that's going to pull contraceptive funds. And even as an OBGYN, I did not realize that we fund contraception for the world. So they're anticipating 1.7 million unplanned pregnancies. And so they said it's going to affect women across the world if that bill passes.
I don't even have words for that. That
Yeah.
is not. It was hard to take it. Yeah, it's a lot.
Yes.
Are there institutional efforts in your hospital to address these inequalities?
There are efforts going on nationally and statewide. I'm on the Colorado Maternal Mortality Review Committee. I'm the obstetric chairperson, so I review all the maternal deaths. We're getting ready to roll out a postpartum bundle to address the fact that 52% of deaths occur postpartum, and the largest majority here and the country is due to overdose and suicide. But we are the first in the state to initiate a postpartum alert bracelet. So when the moms get the hospital, when they leave the hospital, they get a bracelet to go along with warning signs. Because we want the community to know. We need to know the EMS people. We need to know your neighbor sees you fall out, that when you have that orange band on. So we're the first to roll that out. An Advent Health in Florida rolled it out, and it made a difference.
Do you think that women of color usually or tend to ask for a doctor of color to feel connection about certain bias that sometimes go on and equity issues?
I've had 3 or 4 pregnant patients specifically come to me. One comes all the way from Colorado Springs, so she drives
Wow.
90 minutes. When we make up 3 to 5% of the population, and Black doctors only make up 3 to 5% of all physicians. So that's just a reality that they face living in Colorado.
Do you think as an OBGYN, when you got training, that there are certain information or anything that does help the students understand about how to work against systemic racism and challenges within the field?
Not 20 or 30 years ago. No,
Okay.
no.
And
Because
there,
that's how old I am.
yeah.
I'm now, I asked about it at a meeting at the beginning of the year, and there was a public health, CU public health, CU nursing, and CU pharmacology, and they were all, especially public health, they're getting it, but it
Okay.
was all part of their curriculums.
Oh, that's good to
Yeah.
hear.
It's awful how we can see today how the inequality really exists and how doctors and people within the medical field really do treat patients differently due to their skin color.
And this happens every day. We see this with broken bones. We see this with all different cases. It is really horrible to see that this is so common across all medical fields.
Yeah, it's devastating.
Yeah, I also was really glad to hear her discuss postpartum care because personally, I do think that in the United States, postpartum care is terrible across the board, but especially for Black women, it's just awful. Many maternal deaths actually happen weeks or even months after childbirth, yet standard insurance often cuts off support only 60 days postpartum. Conditions like infection or postpartum depression can emerge after that window. And if a woman doesn't have coverage or access to care, those issues can go untreated. I think extending Medicare coverage to a full year postpartum versus only 60 days is a great solution to this issue. I also really liked the system that Dr. Dawn Robinson was talking about. I think it'll be super beneficial to a lot of Black women and women in general who struggle with postpartum care. I think it's very crucial that we keep finding new ways to provide this care for women.
And this is so different compared to other nations. We see how midwives make a huge difference in other countries, that postpartum care is way bigger in other nations. In other way developed nations like the UK, postpartum care is wonderful compared to the United States.
Absolutely. And a lot of hospitals also try to prevent midwives and those plans that these women create with their midwives. And they try to push them out and be like, no, do this medical way, this exactly like drugs. They like very much push their own plan on these patients.
Something else that shocked me was the survey done with medical students and their beliefs that Black people had thicker skin. And there's also ideas over time that Black people feel less pain. I think this goes back to the idea that people think race has biological standing when studies show that does not. Things like sickle cell anemia is evolution based and not race based. Race is more of a social issue. And if there was not a social issue, it would no longer exist.
Yeah, I think that's a great point. It's crazy to me that a lot of professional, educated medical personnel still believe that there are actual biological differences between race when it's been proven that's simply just not true.
I think we've all been taught through our life, or not, if not explicitly taught, we've been told that things like sickle cell have been a race based disease when it never has been. And white people in other races do have sickle cell anemia. It's just less likely because it bases from Africa. And so we see that difference.
Yeah, no, for sure. I agree. I think another topic that she talked about that was really interesting was how Black women tend to feel more comfortable with Black doctors. She discussed how she had a patient that traveled from Colorado Springs to Boulder just to have a Black doctor, which she felt comfortable with. And that's a 90-minute drive every time you have a checkup, an ultrasound, like even to give birth, you have to drive 90 minutes. That's really crazy. That's how, like, what they feel they have to do in order to feel comfortable in a hospital.
Yeah, and it's really sad to think of how she brought up how women of color usually don't feel heard by their physician unless they have a doctor of color. And that is awful that people do express it that way because of experiences they have had within medical care. And they feel like they have to drive 90 minutes just for a checkup.
Exactly. And so many people don't go to the doctor or to the hospital at all, even when they do have a serious condition that needs to be looked at, because they know they won't be listened to. They know they'll be ignored. And so they end up like dying or having these horrible complications, or their disease or their illness gets worse because they just don't trust the doctors and they don't trust the medical system.
Yeah, all this fear is so mentally and physically taxing. I couldn't imagine the constant fear and the daily reminder that some people you might not be taken care of in an emergency situation just because of your race.
And it is like looking at the sickle cell patient. She was just labeled a drug addict, even though she's lived her entire life in pain having sickle cell anemia. And it's in her chart, and even that, she doesn't get taken serious.
Yeah, I think these are some really good points that further prove that we need a system that trusts Black women, that believes them when they say something is wrong, and that builds relationships with them over time, not just during emergencies. It also is about policies. We have to start investing in maternal health care. We have to start holding hospitals accountable for racial disparities and training providers in anti-racist and trauma-informed care. It's crucial that we start to see change in this system. It's not just about saving lives. That though that should be enough within itself. It's also about justice. Every person deserves a safe and supported pregnancy. The fact that race is still such a strong predictor of who lives and who dies in childbirth is unacceptable. We cannot talk about maternal health without talking about racism, and we cannot fix the system without listening to the people most harmed by it.
So, just a little recap for the podcast today. We went into maternal mortality rates, the differences between Black women and white women specifically. We spoke about the story of Angelica Lyons and her frankly horrible experience of birth. We spoke about how explicit bias and implicit bias do more harm than people might realize in the medical field. And we spoke on how institutional racism started within the medical field with the ending of slavery. We had a wonderful interview from Dr. Dawn Robinson. We are so thankful she decided to help us out with our podcast. And to finish that off, just want to reiterate again that race is not biological. There are no biological differences between Black people and white people. It is completely sociologically made up.